Cough is a protective airway response, and ideally it should not be suppressed. So cough is a protective response. Suppose we are choking on something, the cough tends to bring it out. And when there is infection irritating the airways, it is an irritating symptom, but obviously it's trying to clear the secretions. And the secretion staying in the lung can increase the risk of infection staying or becoming worse, like a pneumonic change. And so the coughing keeps chest clear, and it's not to be suppressed ideally.